I'm actually really happy to kick off the first Patient Engagement Open Forum session for 2025, which is titled Bridging Healthcare Providers and Patients in Precision Oncology, Unlocking Nurses and Pathologists' Potential to Implement Patient-Centered Care. My name is Silvia Bornengo, and I'm Associate Program Director for the From Testing to Targeted Treatment Program, or FT3 in short. And today I will be your moderator. So next slide, please. So I see we have several familiar faces. I know some of you are already part of the PEOF community. So for those of you already familiar with it, so welcome again. It's really nice to see you coming in and joining us today. At the same time, I know that there are more people that are coming us today and are totally new to PEOF. So I would like to really take the opportunity to warmly welcome you to PEOF. The Patient Engagement Open Forum is a global multi-stakeholder event, both virtual and in-person event, that brings together different stakeholders to really try to shape better and more sustainable patient engagement. So we are super happy to have you with us today. If we can go to the next slide. Given the fact that it's indeed a global event, we have the opportunity to make PEOF available in different languages. So you can actually activate translation by a pop-up window that should appear on your screen. You can click on open or by clicking in your chat. We have my colleague Matt today, who is going to start the translations right now. He's also our technical guru, so if you have any issue or trouble, feel free to definitely just write to him and ask for help. We have a couple more housekeeping rules. First of all, we would like to invite you to be present and engaged. As I was sharing before, we really like to think of ourselves as a community. So be with us, and while we're going to mute all microphones at the beginning, just to allow for the panelists to share their experiences, we really want you to be hyper engaged if that's possible. So use the chat, ask your questions. If you feel comfortable, feel free to turn on your camera. We'd like to see your face. Let's move to the next slide. And so let's ground ourselves on why are we here today. So today we're here because we really want to discuss with you and identify what matters most to patients in their care. And the way to do it is to really think about what is it that healthcare providers can do with a specific focus on nurses and pathologists to actually deliver better patient-centered care. How we're going to do this is to use our best these 90 minutes we have available. So after this welcome and introduction, we have around 30 minutes of scene setting and panel discussion. And then after this, that's where we're gonna really roll up our sleeves and get into the co-creation part of today's session. And then after the group discussions, we're going to come back into the plenary and wrap up with some next steps. If we can move to the next slide. Without further ado, I would actually like to introduce you to our speakers today. I'm going to start from Catalina Lopez Correa. She's not able to be present in the call, but she's very passionate about the topic that we're going to cover today. So she's shared a video about her experience. And Catalina is the Chief Scientific Officer of Genome Canada and also breast cancer patient. So we'll hear from her later. Maybe I can hand over to Celia to just maybe share your name, affiliation, and we can do a round of intro.
Okay, so I'm Celia Díaz de los Ríos. I'm from Spain. I'm an oncology nurse practitioner, very motivated also about precision oncology and about patients. So it's very exciting for me to be here today to listen to your experience. I do teach in the university, do research, and I'm also, as I said, clinical nurse in the oncology department.
Hi everyone, my name is Umberto Malapelle. I'm the chair of Predictive Molecular Pathology Lab at the Department of Public Health from University Federico II of Naples, and really focused on evaluation of biomarkers to predict the treatment outcomes in patients with solid tumors.
Gloria?
Hello everyone. My name is Gloria Chinyere Oku. I am a breast cancer patient, and I work as a program coordinator for Project Pink Blue. I am also the vice president of the network of people impacted by cancer in Nigeria. Thank you so much.
Hello everyone, I'm Nicola Fusco. I'm a pathologist from the European Institute of Oncology, Milan, Italy.
Hello, everybody. My name is Silvia Piškorjanac. I'm a cancer nurse from Croatia, but I'm also a senior lecturer at the nursing department at my university in Osijek. And with more than 20 years of experience in cancer nursing, I have to admit that precision oncology became my newest passion. I can mostly thanks to Celia and Eleonora. So happy to be here. Thank you.
So thank you so much. It's great to know who our speakers are today. Please feel free to also, for the participants, share in the chat who you are, where you come from, just so we can get to know each other a little bit better. So without further ado, let me hand it over to Umberto.
Thank you very much. So thank you again for involving me in these really important activities regarding the precision medicine and the topic for which we are here all together today. So that is precision medicine, but in particular is also the people that are working in the backstage of precision medicine, like as the nurse, the pathologist, the molecular pathologist, biologist, technicians, because when you see the landscape of precision medicine is really a complex landscape made of different people that are working all together with one aim, that is the patients and the patient care. So we can go to the next slide, please. And this is the key slide, so it's the topic, the means of precision medicine, that is our ability to analyze some characteristics coming from the patients to merge the right treatment with the right patients in the right time. So this is the key weapon of precision medicine, in particular also to avoid and not right treatment in patients in which you have some specific characteristics, like as to comes in your minds and a mutation in some genes like as EGFR or KRAS in colorectal cancer or ESR1 in breast cancer and so on. Next slide, please. Is a really rapid evolving field because, as you can see on the left side of these slides, if your minds go to the 2017, the quantity of the target and the drugs for this specific target that we have in our hands is completely different in 2019. We have more than double the numbers of the target available in clinical practice. To make a practical example, if your mind goes to non-small cell lung cancer, in the last 20 years, we start only with EGFR as target, but today we have 11 approved target in clinical practice, and more than other 5 targets arrived in the next 5 years. Next slide, please. There is a problem, so is the main barriers that we need to ameliorate the access to the technologies, the testing strategies for our patients, because we need to close the gap between the possibility to analyze any biomarkers and the availability to any drug. So this means that we need to work all together at a different level from different stakeholder perspectives to join the efforts in making possible this in clinical practice. So another time, to make a practical example, when we are talking about of next generation sequencing, we have different type of next generation sequencing platforms that are able to test different type of biomarkers, but we need to maximize the access to this type of the testing strategies to give to our patients the possibility to have a really complete report, to give to the oncologist the possibility to select the treatment. So, and in this landscape, the role of nurses, pathologists are really relevant. Also, if you think, in example, the role of liquid biopsy, and we need to involve the nurse, we need to involve the molecular pathologist, the pathologist, and all the people that are working in lab to close this gap. Next slide, please. As we have discussed, we need to join the force, and as you can see also in the right part of this slide with all the logos that you can see, this is the main aim of the FT3 action. So putting all together people works in different types of institution, company, organization, to make all together this big effort to ameliorate the access to any patients to the testing strategies and then to the treatment coming from the biomarkers that we have detected. So this is the only way to proceed, so to work all together, because another time, from practical point of view, if we are not able to join the effort within a network, for sure we are not at a single event, all the efforts that we need to close the gap that we have discussed. In example, in some institution, you can have one single gene testing strategies. In some other institution, you can have the possibility to analyze all biomarkers together, but not in all the instances you need to analyze all the biomarkers. And you need to design in a path, and this is the rule of FT3, or to support the people to design this path, taking into account the differences that we have worldwide. Next slide, please. We have used many times the word design, and if you see in the right part of this slide, to deliver the care in a way that puts patients in the center, we need to be really able to design and a really customized procedure regarding all the places that we have around the world, because the situation that we have in Europe can be different from North America, can be different from Latin America, or the other countries. So, but we need to take into account the specificity of each countries and the main point, that is the patients, in the center part of this part, and then we can start to design the path to close the gap and to give to the patients the possibility to have access to the right treatment. Next slide, please. As you can see here, better than the previous slide, we need to involve different healthcare providers, professionals, patients, advocacy group, because we need to work all together to start the point of this path. And as you can see, this point can start from an nurse. In example, if we are working in the landscape of liquid biopsy, the first step is you need to collect blood, but the way in which we collect the blood for liquid biopsy is completely different from the way that we collect blood for conventional biochemistry analysis. And so this means that the knowledge of the nurse in this first step is really relevant, until the last point, as you can see in the right side, is the pathologist, because after that you have received these samples, you proceed with the analysis of nucleic acids, you need to decodify the complexity of the mutational landscape, to report in a report all this information in a really clinical, intelligible way, and then you pass this report in the end of the oncologist to another time to select the right treatment for our patients. Next slide, please. So the main point, as we have highlighted many times, is the patients. And as you can see in the left part of this slide is the patient's expectative and the patient's experience. And so the rule of the PREMS is really relevant, because it's the only way that we have to know really the feedback of our patients and to know the feeling of our patients. That is the real force that give us the force to start to design this type of course and path. Please, next slide. To doing this in really practical terms, we need to select how to address patients' informations and needs, and we need to collect information in really precise way, as you can see in the left side of this slide. So the top information that we need is where and when, what type of treatments, availability of the testing, what type of testing strategies we are using for, and after that we have completed the course for the testing, we need to know if we are able to connect this information with the availability of the treatment, because in some cases you can also have access to a really good testing strategies, and you are able to select biomarkers and to identify biomarkers for which the treatment in a specific country is not available. And we need to work to understand how to connect this information with the clinical trials in other countries, or with the access to the drugs in other countries, and so on. Next slide, please. So the main points are highlighted in these slides, because we need to collaborate all together to raise the feeling of patients, because as we have discussed during this short presentation, and we have highlighted many times in different contexts, we need to take into account the symptoms and the feeling of patients about the symptoms. We need to take into account, in example, the anxiety. And there are many parameters that can have an impact on this. So to be practical, as before, in example, when you select a procedure for testing to test any biomarkers, you need also to take into account the times that this procedure needs, and overall the turnaround times, because when the oncologist starts to request the test and then you come back with information regarding the test in the hands of the oncologist, you need to keep in mind that there are several steps, like as the sample collection, the sample managements, the nucleic acid extractions, the testing procedure, the post-analytical part, the results interpretation. So all these steps require times, but we need to have real clear in mind that this time need to be aligned with the expectation of the patients, the oncologist, and all the other people that works in this landscape, because need to be clinical relevant. So if we have a test really precise after 2 months, this is not clinical sound. We need to have really precise results and really wide results in the end of the oncologist after 15 days, in example. So this is clinical sounds, and this can reduce the anxiety of our patients. Next slide, please. So I can pass the floor to Silvia to continue with the discussion with the other colleagues and friends that you can see in the slides. Thank you very much.
Thank you so much, Umberto. It was really amazing how you help us really getting grounded on why we're here. And I think we'll continue to do this through our panel discussion. And it's really about, as you were saying, Umberto, just to summarize, thinking about not just thinking about optimal care as providing, the right science at the right time, but really about thinking about value-based care. So what is it that the patient experience can tell us in optimizing patient care? So this is really the focus for today. And I would like to actually start with panel discussion, perhaps by sharing a video story from Catalina. As I was saying before, she's not able to be with us today, but she shared a bit of a story about her care journey, and we would like to share it with you. So let's go for it. I don't think we can hear it.
Hold on, let me see.
Give us just one moment to get it to work.
I am supposedly sharing my sound.
Now
Do you have it on your laptop so that
we don't see
maybe
your screen right now.
let me try again. Okay. Supposedly it's sharing sound. Let me know if you can hear it.
No, we cannot. Perhaps let's do this. Perhaps we can start with while we figure out this more technical piece. Perhaps let's start with Gloria. Gloria, as you were saying before, she's also a patient. And perhaps, Gloria, you can share a little bit about your experience as a patient at the point of care, and what were some of the complexities, but also what are the opportunities that we have to shape better patient-centric care. Gloria, over to you.
Thank you so much, Sylvia, and thank you so much to everyone on the panel session. I'd like to say that precision medicine, from my understanding of what it's all about, is the next best thing for every patient, for everyone in the world today. As a cancer patient, we have our own fair share of the challenges in accessing and harnessing the full benefits of precision medicine and patient-centered care because of our peculiarities and, of course, different disparities that exist based on where you live and where you come from. In Nigeria, for instance, a lot of patients still do not know about precision medicine. A lot of them mistake precision medicine for other things. And there seems to be a lot of mix-up. I've known this from interactions with other patients that they do not even know. And that is one problem, because if you do not even know, then how do you even begin to ask for it? How do you begin to access it? And how do you begin to measure something you don't know and something you have not used? And another problem we seem to have is the cost. It is extremely expensive to buy these medicines here in Nigeria. I use one of those medicines. I use palbociclib. So I know how expensive it is for me to afford it. And because of the cost, sometimes the doctors, out of sympathy for patients, do not even want to mention it. In fact, the first time my doctor said, Gloria, I'm going to place you on palbociclib, I said to her, don't write that in my folder. I don't want to see it anywhere in my folder. And she said, why? I said, because I can't afford it. So there's no point prescribing a medicine I cannot afford. That was what I told her. And that was like 2 years ago. And she had no option than not to put it in my folder, because there was no way I could raise that kind of money at the time, until it became imperative that that was the only option I had, was to use it. And then I had to start making use of it. And I can tell you that there are months I go, there are times I go for months without buying it because of the high cost. And the top problem we have here is lack of access. So sometimes patients know about this medicine, doctors prescribe it, we don't have access to the medicine. So by the time you've been able to put your money together, you get to the pharmacy, you don't see the medicine to buy. So these are the three very big challenges we are having here that I have experienced as a person in the course of my treatment, and many patients are experiencing it. Currently now, I have not been on my medication for almost 2 months because it is not in the hospital where I buy it from. And if I go to buy it outside the clinic, I might get it. It might be a fake product. And if I might get a real one, but it is at way more exorbitant than buying from my hospital. So these are the challenges we face while using this here. I think I should stop. My time is up, I suppose.
Thank you so much, Gloria, for sharing. It's very precious, and thank you for trusting this community with, and share your story. I think it's very powerful, and we hear from you that the challenges are really high, that there is an opportunity to do better for the sake of having better patient outcomes. So thanks so much for sharing. Perhaps I can hand it over to Nicola. Nicola, if you're still here with us, I would like you to perhaps from the point of view of a pathologist, perhaps share a little bit your experience. We know that many of us here maybe are not super familiar with the pathologist role. Umberto shared a little bit with us what is it the pathologists do. And I think Nicola has a really nice story to share with us on how is it the pathologists can really play a role to be more on the front line in supporting patients. So over to you, Nicola.
Yes, Silvia, thank you, and hello to everyone. Yes, actually, as Umberto was saying, the pathologist role is basically to provide a diagnosis of a disease and to provide the results for the analysis of the biomarkers. So the pathology report and the molecular pathology report represent the foundation for everything that happens to the patients from the clinical point of view. And indeed, there's a life many times that is before the pathology report and the life after the pathology report. And despite this role that is essential from the clinical point of view, usually pathologists do not have a direct connection with the patient, because the patient is managed by the oncologist and the clinician, the surgeons. So it is a situation that often requires a collaboration between doctors, between specialties, between molecular biologists and pathologists, and also, of course, with patient advocacy, because often the pathology report is extremely complex for proper interpretation. and the patient has many questions to ask, and they ask the questions to the clinicians. So our experience working in a multidisciplinary team is to foster the collaboration and the friendship with our colleague clinicians in order for them to be extremely confident on the pathology report and the results of the biomarker. These are extremely complex information. And if the clinician is confident, the patient will be more confident in the overall management of his clinical condition. And in our institution, we have started back 15 years ago, one of the first projects in the engagement of the patient in the diagnostic workflow. And now, after all of this year, is no longer a pilot project, is a reality of our clinical activity. And in our pathology division, we have a front office that is dedicated for patients. We have 5 secretary and administrative personnel managing a schedule of the patient that wants to have an appointment with the pathologist and ask questions. And this question can be related to the very pathology report, can also be related to pathology report from other hospital, other institution. And these help, we have evidence that these help patients to get more in touch with what is the pathology report and the results of the biomarkers. For many times I discussed with my friend Umberto that the pathologist can be really important in the patient journey. And when we started our own journey as clinicians, as working in a hospital, the contact with the patient was an exceptional situation. And now we spend a lot of time for this type of relationship with the patient. And the feedback from our oncologists that basically they were the promoter of this initiative is excellent, because the relation of the patient with the oncologist themselves increases, because they have also another point of contact that, of course, cannot replace the clinical referral that is the oncologist, but can help the patient to visualize that pathologist that determine the clinical choice is not just a signature on the bottom of a report, but is a physician that is there to help the patient journey and to help not only the patient, but also the other clinicians of the multidisciplinary team.
Fantastic, Nicola. Thank you so much. As usual, I think while this might not be the reality everywhere, I think it inspires us all to be ambitious. And I think what I really love about what you were saying is that by applying this approach, it helped really in 2 things. On one hand, really empowering the multidisciplinary team, so helping healthcare provider to work as one, right, as a team, right, not just as a pathologist here, an oncologist there, and a nurse there, but really how do we work as one? And this is not only good for the healthcare providers, but also good for the ultimate patient outcomes, and how this initiative also helped addressing, key needs along the patient pathway, which is very important and might, improve at the end the experience in different ways. So thanks so much, really, for sharing. And I love how you were saying before, it's on a pathway. Well, some time ago it was like not even thinkable. Now we're getting into the direction of where this is like a proven value. So thanks so much for sharing that. And again, a lot of opportunities coming our way.
Thank you.
Thank you so much, Nicola. Perhaps I can hand it over to Celia. So to our nurses here today, I would love to hear from you. So we are all a little bit more familiar with nurses and what you guys do, but please share with us your experience and the opportunities you see in the space.
Sylvia, do you want to start or?
You go ahead and I will catch up.
Okay. So for me, it's difficult to speak only from my personal experience because I have been co-chair of education working group of a European organization of oncology nurses, and I have been doing a lot of work with global oncology nurses. So when I give my opinion, I think I'm giving a little bit of opinions of all of them. I was listening to Gloria and to Nicola, and I listened to Nicola before, and I love what they do, and I hope we can copy elsewhere. But I was listening to Gloria saying that that a lot of patients don't know what precision oncology is, and actually there was someone speaking on the chat about what is the difference between precision oncology and personalized medicine. And the truth is that in many occasions, nurses do not know that also. And the truth or the sad part is that most of the time, all of those questions that Nicola was saying that patients have, they go to a nurse because patients tend to feel very comfortable with that. So Umberto was sharing all of that pathway and where the nurse is in all of those moments, but actually that nurse is on all of those moments with the patient. So we normally are the people that spend more time with patients. So we're normally the people who listens more to the patient's needs, to the questions, and when we study, we speak about that holistic and personalized approach where we see a person and not a disease. And actually in oncology, we don't really see people, we see families. So it comes the moment that you may be doing a blood test or you may be hanging some treatment, but you do speak with the people that you have in front of you. And in many occasions, we receive questions that we are actually not comfortable enough to answer, not because we don't want to, but we don't have enough knowledge to. So from the past months, well, we have been listening to nurse experience. A lot of the nurses want to feel empowered to actually be that voice that we feel we are, that we represent patients in many occasions on the NDT. So we are supposed to be working with and for patients, but in many occasions we don't have the opportunities. So there is a lot of nurses that at this point are not present on MDTs, where is actually the place that you normally get to meet the pathologists. For me, it took me 10 years to actually sit down in an MDT and actually meet face-to-face to a pathologist. And right now, I don't even imagine how to work without that MDTs or about chatting with the different professionals that I'm working with. So that experience for us, it's how important it is for me as a nurse and for us as nurses to know what patients want and need, because we know that we are maybe the best pathway to fulfill the needs that patients have. So I don't think I have to share a lot of experience. What I want is to shut up more than I normally do and actually listen to all the different things that you think you need. And you may not think that it's the pathologist or the nurse that the ones that can fulfill it, but actually it may be that we are the ones that can drive that change even without thinking that it's our main role. Sylvia?
Thank you, Celia. I don't have also, very personal experience regarding these topics, but as I came from Croatia, I think it is important to emphasize that nurses in Croatia, we don't have specialization. So we don't have specialization in cancer nursing. So of course, we don't have specialization in precision medicine. I agree with everything Celia told. I'm also member of education working group from of EONS or European Oncology Nursing Society, but I also have lots of years of clinical experience in cancer nursing. I think Dr. Umberto was talk in his presentation about education, Celia also mentioned, and regarding our practical knowledge, and despite this fact that we spend that so much time with patient, we only have that knowledge, I would say practical, not theoretically. For example, at my university, we have class about precision medicine, but nursing students listened that class from physician, not from nurses. So there is no education from nurses to nurses regarding these topics. I think we should, emphasize education. And my personal experience regarding these topics and this little bit of knowledge that I have regarding this topic, I manage, to find some things on my own. I learn in my own, free time. And this education is, of course, not formal. It's informal, but definitely is not enough. So I think we should, emphasize the role of education, at least, as we are talking about nurses.
Thank you so much, both of you. I read in the chat that there is indeed a lot of people that really resonate with what you're sharing and the role of nurses. And I appreciate also you sharing with us a bit of an insights on, what are the opportunities to really move it to the next level. We know nurses do it and try to do as much as they can in day-to-day, but how can we support in making it happen in a more systematic way? So thanks for sharing. Perhaps I am going to ask for someone of my colleagues to share the screen again, and we will try to play the video from Catalina. She's the last person in our panel to share a little bit her story as a patient. And then after that, we can really move into our co-creation part of today.
Hello, my name is Catalina Lopez Correa. I am trained as a medical doctor with a master and PhD in genomics, and I am now Chief Scientific Officer for Genome Canada, a not-for-profit organization that supports genomics research across Canada. I have more than 25 years of experience in the field of genomics, in particular in precision health, precision oncology, but in general in the use of genomics for the diagnosis, treatment, and prevention of different diseases. I was diagnosed with breast cancer in April 2023, and since my diagnosis, I really have been thinking very differently about genomics and the implementation of genomics in the healthcare system, and have been really more aware of the challenges and opportunities we have with genomic technologies. Today, for this meeting, I want to share two examples. One good practice, and maybe the other one where there's a space for improvement. In my interactions with nurses and pathologists across this cancer journey. So the first example with nurses, really the positive one has been all really the interactions I had with nurses during chemotherapy. For me, exchanges and interactions and all the questions I had and all the challenges I had with side effects from chemotherapy, the first line and the first communication I always had has been with nurses. They have been extremely helpful, supportive, and knowledgeable during this journey. And they helped me really understand the side effects of the chemotherapy in a much better way and really personalized to my case. So it's maybe not directly linked with genomics, but it's a critical example on how nurses are making a difference for cancer patients and are helping really advance a more precise and personalized treatment for patients. Now, the area for improvement and the example I will give is the interactions I had with a nurse here in Canada, where I was invited to join a study where they will sequence the tumor, the whole genome of my tumor. They will do the whole genome sequence of my breast cancer tumor, and I had to sign an informed consent. Of course, I read the informed consent. I was, line by line, and maybe too much because, of course, I am a geneticist, genomicist. This is my field. I was excited about. But then I was very disappointed when I had the appointment with the nurse because I thought it was a missed opportunity for the healthcare system to have a person that will be well trained and able to answer at least part of the questions I had. But unfortunately, the nurse was not well prepared, didn't really have much knowledge about the program, didn't have much knowledge about genomics, about the informed consent, about potential incidental findings, as we call. So all the questions I had were not really answered by the nurse. The other example I want to give is about the pathologist. So one positive example was the interactions I had with pathologists actually in Colombia. And that was not my breast cancer journey. That was in 2016 when my father was diagnosed with glioblastoma brain tumor. And I was looking for ways to do genetic testing to sequence the genome of the tumor. And finally, it was the pathologist that helped me get some slides, some tissues from my dad's tumor to be able to do some sequencing and some analysis of molecular analysis and molecular profiling. So I'm always thankful and will always remember that as a very positive interaction with pathologists. A bit of a more negative one was here in Vancouver, in Canada, when I was trying to get the results of ER2, my biomarker for my breast cancer tumor, and ended up calling the pathologist that was frustrated, angry with me because patients should not call them pathologists. Patients should be only interacting with the oncologist.
So we are going to move on because I know we have some issues with the video, so we're gonna cut it short but share it afterwards. Apologies with the volume. It's a great story, so we'll make sure to share it with you. And it was very nice to hear from Catalina and a little bit her experience on how we have opportunities. There are great examples out there on how nurses and pathologists can really play an empowering role for the patients to, really, manage their care in the best way possible, but also challenges that still exist. Before we move on, again, I think what I really take away from this session, and I thank our speakers again, is the importance of really trying to push the limits of what's possible today. So I think we have an opportunity to start doing it here together. And the way that we want to do it is, again, we know and we talk very often with healthcare providers around what is it that we can do to improve how they work, how they deliver care. Like Celia was saying, we need more education, right? But now we want to flip the conversation. Let's flip the conversation. Let's talk about what is it the patients want to see? How is it that we can best address their care in the right way? And this is where we would like to have your support in the group discussion that is about to come up. We want to hear from you, whether you had a direct experience, whether you're a caregiver or speak with patients very often. We want to hear what do you think patients want to see, so that when we will speak with healthcare providers about how is it that we can improve care delivery, we also bring the patient experience there to say it's not just about providing the right science at the right time, but keep in mind that this is what patients would like to see, and this is a way to optimize care also from a patient experience point of view. So without further ado, I would like to hand it over to Eleonora to share with us how we're going to roll up our sleeves and get into work with our group discussions.
All right. Thank you so much, Sylvia, and thank you again to all our panelists to set the scene for us to get started with this co-creation activity. I will just steal a couple of minutes from you for a few explanations around how this co-creation activity will look like and what we're going to do together in the next 40 minutes. So the first thing that we wanted to share with you is if throughout the breakout groups, you may find useful to activate subtitles as much as Wordly may not be available in every single room. You may leverage Zoom captions. So on the bottom of your Zoom, you're going to see you can click on show captions. You can activate translations first. You can select your speaking language, and then you can activate a caption language so that whatever the speaker is saying is translated to you automatically as subtitles at the bottom of your screen. And please write in the chat if you have any challenge and we can support you. The second piece is, as Sylvia was sharing, the objective of this group discussion is really to focus on the patient's experience along the care pathway and what are the expectations of patients and how can different healthcare professionals come together to support patient needs and deliver patient-centered care. And so we will have 4 different groups. We will split into these 4 groups that will be moderated by different individuals. The groups will be focused on the different phases of the care pathway that was previously shared also by Umberto. So we have screening, testing, diagnosis, and treatment. And we will start by being allocated to a random group and then rotate after 15 minutes to contribute to a different phase. So the idea is that keeping in mind the patient experience throughout the whole care journey, so keeping in mind what each phase really means for a patient, we start mapping together and discussing what our patient needs at that specific stage and what would they need from their healthcare professional. So which kind of information, what kind of support, how could pathologists and nurses in particular help address those needs? And if you're aware of any good case example, anything that comes either from your lived experience or from your network that you can be sharing and that could be useful to understand patient expectations throughout the care pathway, that would be also very useful for us to know. We take precision oncology as an example, but overall we talk about patient-centric care as a broader topic. So you feel free to bring examples from diverse expertise if you have diverse expertise. As in most of PEOF sessions, we're going to use a group map to help us throughout the co-creation to capture your insights and make sure that we can then build on your insights to further inform our project. So the group map will look like this table. So we will all be able to see what the different groups are discussing. You can, there is a link that should be shared in the chat shortly. You can join that link, you indicate what is your stakeholder group, and then you can input your insights based on the group in which you fall into. You can keep on providing insights even to other groups, as you can see. And we can build on each other then when we rotate to see what the previous group has discussed and keep on discussing on that. So I don't want to take too much time. I know we're already tight on time, so I would ask my colleague Matt to start the breakout groups, and you're going to be there. Welcome to my moderators that can support a bit more the discussion. So I wish you a nice co-creation activity.
I am sure that many of you would have loved to continue the conversation for longer. At least in our group, we would have loved to. But luckily, this is just one of the conversations we'll have about this topic, because I see that everyone who joined today was really motivated about having this conversation. So I'd like to wrap up with some next steps, because I know we are basically at time. So we'll ask you to bear with us with a few next steps. But again, I'm already very thankful for the quality of trust from these group discussions. I think everyone really came in sharing, you know, in a very humble but open way. And I think this is very precious. And I think this can get us very far. So perhaps we want to share the screen again. We would like to hear your feedback from today's session. So we have a couple of questions, if you have the time, that I think will appear on your screen very soon. But we care about hearing from your perspective and also see if we can do better next time. So if we have a poll, I don't know if it's happening now or afterwards. Yes, it just popped up. So feel free to share your feedback. In the meantime, as I was sharing before, we want this to be an inspiring first discussion about this topic. We would like to invite you to actually be part of a group with myself, Celia, Umberto, Nicola, Silvia, Gloria, many other people from testing to targeted treatment community, FT3, are extremely motivated by this topic and actually want to make a difference. We want to push the boundaries, and it will take time, but until we, sit down together and brainstorm on how we get it done, we will not make progress. So if you're interested, please reach out to us and let's continue this conversation. We also would like to invite you to join the Precision Medicine signups to stay connected with the ecosystem. The link will also be in the chat. And of course, we will be sharing the outcomes of this session with you. So you'll receive an email from us in the next while, so that we can, everyone can capitalize on this collective intelligence that we've gathered in today's session. One more thing that I want to share with you is that this session was the first one of 2025, but there will be many others coming up. And the next one is actually on the 26th of February from 12 to 1:30 p.m. CET. And the topic is actually understanding health technology assessment and how patients can shape healthcare decisions. So this is part of a patient engagement one-on-one series that is done in collaboration between the Patient Engagement Open Forum, Debra Foundation, and PFMD. And it's really a series of virtual patient engagement open forum events that also address the needs from patient advocates from low middle income countries. So feel free to stay tuned and reconnect with us. And for all of those that were new to PEOF, welcome to the community. You will hear from us, and let's make sure that today was just, again, a way to start provoking lasting change, but it doesn't end here. It starts here, and it will continue together in the next year and months. So again, thank you so much for being with us today, for the level of trust, your insights you brought into this. And, let's talk soon, and let's reconnect in other moments. Thank you so much.
Thank you all.